In the KUM News Zoom room, Speaker Therese Terlaje. Good morning, Madam Speaker.
Morning, Chris. Good morning, Sabrina. Good morning, Guam.
Good morning. Thanks for coming on. I know you're going into session soon, but real quickly, can you give us an update on what's happening with session and where are we?
With session, sure. We've almost exhausted our second reading folder so far. We have one more resolution this morning. That's the resolution on the insular cases, the Vice Speaker's resolution. Other than that, all the bills that we considered were moved to third reading, and we will be voting on Friday at 4 p.m. However, I am expecting that some motions will be made to add some bills today. So we'll see when we go back in.
You did issue a release also yesterday. If we can go through that regarding ARP and Resolution 93.
That's right. Okay, so you remember the plan that the legislature came up with, that we got all 15 senators to agree, and we got consensus on that. We submitted that to the governor as our suggestions for spending of the ARP funds, right? So we took that spending plan, I put it in a resolution. I want to allow,
hold on, Speaker. There's something going on here. Are you rubbing the microphone with your sleeve?
Oh, maybe with the papers.
Okay.
Yeah, okay. Can you just start over? Sorry.
Okay, so we took the we took the spending plan that the senators all agreed to, that the 15 of us, and we gave it to the governor. So I also took that plan, put it into a resolution. It's the same plan, put it in a resolution so that we can have a public hearing on it and receive some more public input. Because what we found was that everyone's got some good ideas, and they want to tell us how they think that money should be spent. I agree that they should be heard in that regard, and so I'm trying to give an opportunity for that to happen. And it's of course, we'll take everything that they give us. It will be permanized in a record, available for all senators, available for the agencies that are actually implementing these plans, and available for the governor for consideration in her plan. And whenever we get her plan, I'm sure that all plans can be made even better with more input. So for me, the more, the better. And so that's the goal. It's just to make things better. So even our suggestions can be improved.
So you're basically taking the legislature's plan and turning it into the people's plan, right?
Correct. Yeah, we're going to do our best to finesse it, right? Now we've learned from the guidelines. So since our plan was formulated, the guidelines were issued. So of course that now will have to influence what really is eligible or not eligible to be spent. And so we've received some suggestions already that some of these things, for example, the funds that we allocated for GPD and GFD, that those might not be eligible. So perhaps we will be able to reallocate those to other places. Things like that. So the guidelines and then input from the agencies. So I'm very much encouraging agencies to come out and talk about their plans. And of course, we are encouraging them to do this at the budget hearings as well. So we want them, like GCC came in and we said, if you got ARP funding, we want you to use it for this. Would you be able to do that? And they were able to lay it out exactly. Yes, we are able to take $7 million and we will increase training for new jobs. We are going to increase capacity for nurses and all these jobs that we need so very badly here on Guam. And so that's the kind of thing I really appreciate. We also heard, of course, something different like public health coming in and saying, we are counting on 17 million in ARP funds, which of course we did not set aside 17 million for operations. We're trying to put this money into programs that are really going to expand services. So we did give some to public health, but we want them to expand what they are currently doing, what we always appropriate for them to do, which is foster care, senior citizen services. All of that is normal. That should be funded normally, but we want the ARP funds to go to an expansion of those things to really, really help people, and in a permanent way, in a more, to change this for generations.
When we had you on last time, you mentioned that you were going to write this letter to, I believe it was the governor or BVMR, DOA, or somebody about the RISE Act payments to go ahead and get those checks ready so that when the funds actually get here, you know, we could send them out immediately. Did you ever get a response to that request? Do you know if, okay, they cut any checks or anything? Or
No, I'm sure they haven't. Otherwise, they would have announced it. But no, no response. And as far as I know, the checks are not cut yet. So that's unfortunate because the cash, apparently we have the cash. It's sitting there now. And it can be used without, you know, any further real red tape. You know, we don't have to go back like we had to do with some of these plans and get the feds to approve it again. We can spend that now. And so that's why I was hoping that the checks would be ready and they would go out for those RISE payments. I still think they should. I still think they should do that. And if they want to expand the program beyond the current, you know, eligible recipients, then by all means, let's work on that. But in the interim, send those out right now to those.
I read the letter. It was good. I was sorry to see that there was no response. But Speaker, I wanted to ask, just like, do you feel with these public hearings and this process where we're going to fold in the public input, which is great because, I mean, last time no one asked us about the CARES Act and how we felt it should be spent. So this is awesome. But do you feel that there's some time sensitivity in being able to shake the tree and get that public input? Because I feel like the clock is ticking. I mean, the governor has the money. She says she has her plan. You guys have your plan. And I'm just worried that we have a public hearing, and then by the time we get the public's input, some of the money's already been put here, put there, spent here or there.
Well, I'm not that worried about that. I understand your concern because, of course, they're going to come up with a plan and they will have allocated all the money probably before this public hearing. That's very much a possibility. However, just like with our plan, all plans can be made better. I really believe that. And I really believe public input. I mean, we've got smart people here on Guam, much smarter than me. So I expect them to make our plans better. And that's what we're trying to do. We might not be able to revise the entire plan or, you know, but I think there will be things that will be made better because of public input. It's like no one asked us our opinion on the CARES money either, Chris, right? And so I totally understand that, and I'm just trying to create opportunity for that input so that we can have the input, right? And whether they take it or not, that's a whole other question now, right? And so we're just going to put this on the table, and I think it should be good for Guam. I don't know. I've always appreciated input because the more I've thought I really knew about something and someone will tell me how to make that even better. And I appreciate that. So not everyone's going to listen, but I think most of us are going to listen because we know we're not the masters of all knowledge, right? For sure.
Since the closed door meeting at Adelup with the senators and the governor and her financial people, have you had any other talks with the governor or any kind of communications with any of her people about when this plan is going to be finished and presented and when we're all going to know anything about the ARP funds and how it's going to be distributed?
No, and I did send them a letter after that as well. When I heard, Mr. Byrne on your show talking about what he submitted, I sent a FOIA to him and also to the BBMR director asking them for any documents that had been submitted. And they said they did not need to submit a plan to the federal government in order to get the cash. So I'm not sure, because I know they've submitted something, but their response to me in the FOIA was there is nothing, no response.
Right,
there are no documents if this outlining the plan. And so that's one thing. We've also just heard from Mr. Byrne and the director of BBMR here in our hearing. We had a committee of the whole on one of the bills, and so they were here and we did ask them a few questions about it. For example, would this bill impact our receipt of ARP funds because we're changing the taxes, right? We are giving exemptions on BPT taxes, and the ARP guidelines are very clear. If you reduce your tax revenues, they're not going to cover that. They're going to make you reimburse that to them, in fact. And so we don't want to do that. And so we tried to make it very clear. And they gave us a number of about 7 million, that if we reduce our tax revenues beyond 7 million, we're going to have to reimburse all of that. And that's one of the reasons why, there was a motion on the floor to expand the exemption even further, to double it. But I couldn't support that because that was very clear according to the guidelines that they would ding us on our ARP funds, and we want the maximum funds. As I said, this is an unprecedented amount of funds coming to the government of Guam and the people of Guam, and I want the people of Guam to benefit from this. And so I don't want any of it to be taken away, taken back.
Right. But any chance, have you been tracking what's happening with the quarantine and ISOFAC facilities and the amount of money that's being paid? Because we had Jenna Gamindi Bloss on yesterday, and she was saying that 26 million has been paid in invoices, and there's X amount of million left for the quarantine facilities. And this is just for DUCIT, and it's being paid with the federal funds. The CARES Act was paying for it, but only with reimbursement, but only $4 million has been reimbursed so far. And this is just for the ones that they procured, right? So the ones previous, like the Pac Star, the Wyndham Gardens, the Days Inn. Yep. Do you know if we were ever reimbursed for any of those costs?
I don't know, and I remember at the time when we had an oversight hearing regarding that, Senator Perez did, it was pretty clear that they were just saying those were going to be paid out of CARES funds, not seeking reimbursement by FEMA. Since then, of course, they've changed their procedures and they are now seeking reimbursement from FEMA. So the fact that they haven't reimbursed it all, I'm hoping is just the way it works, and it's not that we should be concerned, because these people who are submitting our reimbursements to FEMA up there at the Homeland Security, they're experienced, and so they're supposed to have everything in line in advance before we spend it, to ensure that it's eligible for FEMA. And they've done this with the hospital's expenditures, the SNU expenditures, and hopefully the isolation and quarantine facilities, that they've lined them up so that they are reimbursable, so that they qualify and there's no hiccup there. Yeah. So I just hope that that's the case, Sabrina, as just like
it's probably not though, Speaker.
And I'm glad you said they know what they're doing over at GSA and OCD.
And that was the problem, was that the
I'm thank for the reimbursement for FEMA part. They know how to submit the claims to FEMA. They've worked with FEMA. They are working with FEMA. So if there was an issue, now, if they're not bringing it to our attention, that's a whole other situation.
That's probably what it is.
Yeah, hopefully
they said they're working on the documents. No, but I'm just saying that they know what they're doing, right, in terms of the FEMA reimbursements, paperwork, as opposed to the hotel quarantine hotels. The procurement was or non-procurement,
all over the place.
That occurred.
And that was the problem. Is I remember before he went on military duty, we had the GHS OCD administrator Charles Estevez on. And he had said that what they were being told or tasked with was recreating a record of procurement that would be good enough to stand up to the reimbursement process. And I don't even know if that's even doable, because there was like little to no paperwork.
Yeah, I don't know the outcome of that, to be honest with you. That I'm curious about as well. But I did think we've heard from the AG since then, during maybe your show or another hearing, that who said that those were, I don't know. I'm not going to say anymore. I think, we should follow up maybe on the outcome of those early procurements, if they were ever reimbursable. But my guess is no, they weren't.
All right, Madam Speaker, I know everybody's watching this. Session's at 9. They're probably waiting for you to bang the gavel.
I got to go to session, yes. So thank you so much. Thanks. And so the hearing again is June 4, 11 a.m. It's going to be in our public hearing room. We're going to do it, we call it hybrid, where if you need to come on virtually, we're going to allow you to do that. Otherwise, you can attend in person, okay? And so we're encouraging, of course, the agencies, but the public. This is for the public to come in, and if they want to have some input on how we spend this ARP, the American Rescue Plan funds. All right, and thanks so much.
Thank you.
Take care. Have a
Madam
great
Speaker,
day.
right on, break a leg. I mean, not literally, but you know what I mean.